3, Brian Amadi, member, lawyer, and duly enrolled advocate of the High Court of Kenya, member of the Law Society of Kenya. Number 4, Mr. Isaiah Chibi, member, accountant, member of the Institute of Certified Public Accountants of Kenya. Number 5, Mr. Dennis Miskela, member, representative of Workers' Union. Honorable members, I now direct that the Select Committee on Appointments proceed with the vetting of the nominees as members of the selection panel for the purpose of recruiting a suitable candidate for appointment as County Secretary. Thank you. Honorable members, you may proceed. Clerk.
Order number 4, petitions. Order number 5, papers. Order number 6, notices of motion.
Honorable Samson Ochieng Jera, you have a notice of motion. Honorable Jera, proceed to read your notice of motion.
Thank you, Madam Speaker. I wish to give notice of motion of the motion. I wish to give the notice of the following motion. That Article 67 of the Constitution of Kenya, 2010, establishes the National Lands Commission with its functions being, amongst others, to manage public lands on behalf of the national and county government, and to initiate investigation on its own initiatives or on complainants into present or historical land injustices, and recommend appropriate redress concerned that public land and upon spaces reserved for the development of the essential public amenities such as schools, hospitals, markets, and recreational center facilities, and other infrastructure and private, individual, and entities, thereby denying residents access to essential services and impeding the county government's ability to implement critical development projects. Deeply concerned that the continued grabbing and encroachment of these parcels of land undermines the urban planning frameworks, violates land use regulations, and contributes to the deterioration of service delivery in sectors such as education, healthcare, and sanitation. Noting that the National Land Commission, NLC, is constitutionally mandated to manage public land on behalf of the national and county government, and it is empowered to initiate and investigate or initiate an investigation into historical and current land injustices. Now, therefore, this Assembly urges the County Executive, in conjunction with the National Land Commission, to 1. Conduct a comprehensive audit and investigation on the land, on all public land and upon spaces and open spaces in Nairobi City County that have been irregularly allocated, occupied, or developed in the county. 2. Publicly share the outcomes of the investigations and table comprehensive report with recommendations to the relevant national and county government institutions, including the County Assembly, for further action, and take appropriate action to reclaim such parcels of land where illegality has been committed, either constitution or the courts of law. Thank you, Madam Speaker.
Clerk, let's proceed.
Order number 7, statements.
Honorable Hashim Kamau.
Thank you, Madam Speaker. Pursuant to the provisions of Standing Order number 47-2C, I wish to request a statement from the Chairperson of the Sectorial Committee on Labor and Social Welfare regarding the status of confirmation of officers employed within the County Executive, commonly referred to as the Green Army. Madam Speaker, the matter concerns 55 staff members engaged on terms designated as permanent and pensionable. These officers continue to perform the duties, but to date have not formally confirmed in their appointments. It is further alleged that this protracted delay is linked to purported failures in their performance appraisal process. Madam Speaker, the continued non-confirmation of staff who have served beyond their probation period raises serious concern regarding compliance with Section 42 of the Employment Act 2007 regarding the maximum duration of a probationary contract and Section 71 of the County Government Act 2012, which provides for the automatic confirmation of public officers upon the lapse of the probation period without a formal decision. Furthermore, any decision to deny confirmation on the basis of performance must adhere to the principle of Article 47 on fair administration action and Article 41 with regard to fair labor practices of the Constitution, which mandate procedural fairness, including the right to be heard, as stipulated under Section 41 of the Employment Act. Madam Speaker, in the statement, the Chairperson should inquire into and report on a comprehensive list of the names and the corresponding employee numbers of the 55 staff members involved, a detailed statement of the specific reasons supported by documentary evidence for the non-confirmation of the mentioned staff, and an explanation of how the process complied with the requirements of Section 41 of the Employment Act and the constitutional right to fair administration actions. And lastly, Madam Speaker, certified copies of the relevant official documentation, including minutes from the County Public Service Board and minutes from the sector that formally considered and resolved the non-confirmation of the employees, including the dates of such resolution. Thank you, Madam Speaker.
Chairperson, Labour Committee. Vice Chair, Labour. Do you have a member of the Labour Committee in the House today to make an undertaking on behalf of the committee? Yes, Honorable Kimemia. You're not on Hansard. Facilitate the communication device for Honorable Kimemia. You're still not on Hansard.
Sorry for that, Madam Speaker. I request the member to give us 2 weeks.
We'll be back with the information.
Honorable, 2 weeks. That is noted. Honorable Mark Mugambi.
Thank you, Honorable Speaker. Honorable Speaker, I first of all thank members for Oshokia Gwoko. And
You are reminded to use parliamentary language.
anyone that has not done that, kindly make sure you see me. Honorable Speaker, I request a statement subject allocation of plot number LR number Nairobi stroke block 109-2380. That's an open space along my drive. And Honorable Speaker, pursuant to Standing Order 47-2C, I wish to request for a statement from the Chairperson of the Sectoral Committee on Lands, Planning and Housing regarding the allocation of LR number Nairobi stroke block 109-2380, an open space along Moi Drive. Honorable Speaker, the parcel of land is legally designated as an open space stroke public utility land and is situated along Moi Drive. I seek clarity concerning what I perceive as an improper allocation of the said parcel number that contravenes its original purpose and exacerbates a critical public infrastructure deficit. Honorable Speaker, in the statement, the chairperson should inquire into and report on A, what was the original legally mandated intended use of this open space, Nairobi stroke block 109-2380, as per the Nairobi Integrated Urban Development Plan, that is the new plan, and the relevant Physical Planning Act. Honorable Speaker, B, on what grounds was this parcel designated for public use, allocated to a private entity? I request full disclosure of the allocation process, including beneficiary's name, the purpose of the allocation, and the public benefit that was cited to justify the alienation of this vital land. Why was this land allocated for an alternative use when there is severe and pressing need for a dedicated bus terminus to service the matatus and buses plying the Moi Drive route? The current situation where the public service vehicles stop and pick haphazardly along the road is a direct result of this infrastructural gap. And D, steps that the county is taking to safeguard public land from potential land grabbers. Thank you, Honorable Speaker.
Is the chairperson planning committee in the house today? Vice Chair Planning Committee? Do we have a member of the Planning Committee to make an undertaking on behalf of the... Yes. Let us have a Planning Committee.
Bit confused, Madam Speaker.
Yes.
I thought the Honorable Roro is a member of the Planning Committee.
Is he are you a member of the Planning Committee, Honorable Roro?
Honorable Speaker, for the last 8 years I've been in this house. I've never been a member of the Planning Committee, Honorable Speaker.
Honorable Madam Speaker, I was misquoting because in the yesteryears of Roro's life, his assembly, he was the main collector of the transport sector. I was confusing between transport. You know, he had a lot of criminality those days. the mashimo mentality.
He has confirmed he's not a member of
Now,
the
because
planning
he's not a
committee.
member of planning, allow us to respond to this in the next 2 weeks after the recess of CASA Games.
Honorable Roro, I believe you have had the commitment for 2 weeks.
Thank you, Honorable Speaker. Yes,
Yes,
yes.
we have Honorable Mark Mugambi.
Elias Roro.
Proceed, Honorable Mugambi,
Yeah,
proceed.
2 weeks is fine with me. However, I think Majority Leader and the committee should help me as we await the 2 weeks from CASA Games to put a caveat on any approval plan that might be issued to this said plot. Thank you.
Chairperson Water, you have a response to a statement by Honorable Kiogora. Is Honorable Kiogora in the house? No. Chairperson Planning also has a response to a statement requested by Honorable Samuel Kanyikago. Honorable Kidenda, you're the one giving this statement. Response to the statement.
Thank you, Honorable Madam Speaker. The Sectoral Committee of Lands, Planning and Housing is established by the Standing Order 209 and is mandated by the third schedule of the Standing Orders to investigate, inquire into, and report on all matters related to county planning and development, including statistics, land survey, mapping, boundaries and fencing, housing and outdoor advertising. Honorable Madam Speaker, members of the County Assembly Honorable Speaker, the member of the County Assembly representing Mwiki Ward, Honorable Samuel Kanyikago, MCA, requested for a statement from the chairperson of the Sectoral Committee of Lands, Planning and Housing regarding the surrender of land in the subdivision of land in Mwiki Ward. The holding parcel number, LR number 9363 LR number 9363/65, LR number 936/85, LR number 30393, LR number 30393/1585, and LR number 30393/1988. In the statement, the member requested for a report on the following aspects. 1, whether there was a surrender of land for public use during the subdivision of the parcel numbers. LR number 9363/65, LR number 9363/85, and LR number 30393. Finally, LR number 3039/1585, and additionally LR number 3039/3/1988 in Mwiki Ward. And if there's any details and proof of documents and maps provided. Number 2, whether the developer of LR number 30393/1988 have approvals from the county for the ongoing constructions Proof of the same should be provided, and steps that the county government is taking to ensure that all surrendered pieces of land are tracked, accounted for, and a register of the same maintained. Honorable Madam Speaker, pursuant to the provision of Standing Order 4712D, the committee invited the County Executive Committee member of Built Environment and Urban Planning to its meeting on Wednesday, 6th August 2025. The member who requested for the statement was also invited to the meeting. Honorable Madam Speaker, on Wednesday, 6th August 2025, the committee held a meeting with the CEC of the Sectoral Committee, and the officials deliberated responses to this statement. Honorable Sam Kago, MCA, was in attendance. In this regard, Honorable Speaker, I wish to report to the Assembly as follows. Highlight. Thank you, Madam Speaker. I appreciate that because it's fairly long. Let me come to what is critical. Let me speak on this. On the 6th September 2012, an approval for the subdivision for LR number 9362/65 into 24 plots was issued by the county. Thank you, Madam Speaker. I appreciate your intervention. The approval was later disapproved on the 28th July 2015 and the titles currently in the name of Karanja Cargo. I'd like to mention that this is no relation to Mheshimiwa Cargo, the one who asked this of the committee. Allow me to go to what I believe is critical. In this regard, the committee requested the executive members responsible for the built environment and urban planning to immediately deploy multi-sectoral enforcement team to the parcel of land in order to protect the land. Because what came out as the committee was deliberating was the misinformation and some steps that were taken that had not been regularized. And allow me to just highlight this. Number one, suspend all irregular construction on the parcels of land until the developers comply with relevant guidelines. Number two, remove all structures on parcels of land that were surrendered for public use on legally subdivided plots. Consequently, the CEC reported as follows via a letter that was addressed to us. Number one, the county executive planning and enforcement officers carried out a site visit on the said LR numbers and established as follows. A, the parcel of land has no subdivision approval from Nairobi City County Government and comprises of industrial, commercial, and residential development without approvals from the county. Enforcement notices were served to the illegal developments to suspend irregular constructions and operations. The parcel, B, on LR number 9663/85/83, the parcel of land is owned by one Joel Kanyi Kimani and Josephine Jerry Ngugi as per the ownership document provided by the development enforcement notices that were served. C, on LR number 30393, the parcel of land is owned, yes? Are you talking about section B? B. Okay, allow me to read. Thank you, Madam Speaker. On LR number 9663/85/3, the parcel of land is owned by Joel Kanyi Kimani and Madam Josephine Jerry Ngugi as per the ownership document provided by the developer. Enforcement notice was served to the developer and submissions was done via an application number PLUPA BOW 000544-N that has not been approved. C, on LR number 30393-1988, the parcel of land is owned by Bright Shine Housing Limited as per the ownership document provided by the developer. The said parcel of land was subdivided into 2 portions and was approved by the county. The developer has developed multiple dwelling units without the approval of the county. D, LR number 30393/158, the parcel of land is a public land for church use. There is illegal subdivision of it, and there exists an illegal development, a site of there's an illegal subdivision on it, and there exists an illegal development that was removed by the planning, compliance and enforcement officers. Notice was served on site and on Mr. Joseph Kimani and Mr. Joseph Kimani arrested. E, a report on the finding of the site visit is hereby attached. Madam Speaker, Honorable
The 9363/3 is currently registered to one Joel. I'm wondering what has happened thereafter. They have just said it is registered to this person, but what has happened thereafter? I was the president of the committee, but on the developer. Now, Madam Speaker, I was present in the committee. The CEC present never presented anything, never produced any documentation on the developer who is developing this parcel of land. There was nothing which was discussed. He was to come back. So I'm hearing this here. No, I didn't see a report. I have not seen that report. I was present. I was invited by the clerk. Yes, I did. The CEC was to come back on the development on this plot. But he never came back. I was never invited again. And that, Madam Speaker, it is on whether the developer, it was my statement number 2, whether the developer LN number 30393/1988 have approvals from the county for ongoing construction. Proof of the same should be provided. The developer is doing a whole estate in 100 acres of land without proper documentation to do that. It was never discussed.
Thank you, Madam Speaker. I'm just wondering if the member, he thinks that the members of our planning committee are mad people because he was before the members and actually he returned even the report. Was it yesterday? That is when he returned the report to the clerk and we agreed on each and everything the members read here. Nevertheless, if there is something that he's not satisfied, he can bring it back to the committee. Before we brought this report here, he was given, and he brought the report yesterday to the clerk. So I'm wondering if he's a normal human being.
Chairman, Mr. Speaker, I think he needs to withdraw that and respect the people of Moiki.
On the supplementary issues that you have raised.
But Mr.
And
Madam
also,
Speaker, am I not a normal human being? He has said I'm not a normal human being.
You are a normal human being?
No, he should. No,
but now that you have raised
the chair
that,
should withdraw that.
Take your seat, Honorable Kago. Chairperson planning, surely. Withdraw that.
Madam Speaker, I'm wondering.
Just withdraw because you don't have the capacity to gauge his madness or sanity.
Okay, thank you, Madam Speaker.
You don't have evidence that he is mad.
No, I don't work in Madare, but
since you're not experienced in that sector, you have not studied that, withdraw your statement. We proceed.
Thank you, Madam Speaker, for your guidance.
Assembly's time.
Thank you, Madam Speaker, for your guidance. I withdraw the statement. Thank you. I withdraw and apologize.
Clerk, let's proceed.
Order number 8, the Nairobi City County Health Services Bill 2025, Assembly Bill number 3 of 2025, second reading.
Yes, Majority Leader.
Allow me just to pass across for those who do not see the portal that all practices for CASA games is proceeding from today. And please get liaised with VG, the chairperson of operation, and also the team captains to be shown the field because you don't have a specific field, and Mheshimiwa Hashim Kamau. I think it's very important for us to have that information. Thank you.
Honorable Moses Ogeto.
Honorable Speaker, the Chair for Water should understand when the majority whip is on his feet. Unless, I don't know which point of order number what. He could...
Just proceed.
Thank you, Madam Speaker. Honorable Speaker, I beg to move that Nairobi City County Health Services Bill of 2025 be read for the second time. Honorable Speaker, before I call the seconder, it's good to bring the gist of this motion for this House, Honorable Speaker. Honorable Speaker, you are aware that Nairobi County has a population of 5.7 million during the day and 4.9 million at night, Honorable Speaker. Honorable Speaker, out of my analysis, we are able to have 120 health facilities that are operational currently.
Honorable, if you in Palapala, you should consult in Lawtons. We are transacting important business.
5 level 4 hospitals and 11 level 4 hospitals and other health facilities. The gist of this bit, Honorable Speaker, is like World Development Program, Honorable Speaker, which we started in around 2015 with my colleague, Honorable Peter Anyule Imatok, Honorable Bishop, Honorable Anthony Kirabu. This is the journey, this is the way we started the program of WDP, where we say that every ward must get equal share of its services and taxes which it pays to this county. This motion, Honorable Speaker, this bill today, Honorable Speaker, needs to tackle the issues of health that every ward in the Republic, in Nairobi County, in the Republic of Kenya, should have a health facility. That health facility must be constructed, must be equipped to the standards that are guided by this law, Honorable Speaker. Honorable Speaker, I believe the executive will run away with it and ensure that, like in my ward, I have more than 2 health facilities. They are in a position to give a health facility. I had Honorable Lindy doesn't have even 1 health facility, a public health facility, Honorable Speaker. This motion is going to cure that, Honorable Speaker. Honorable Speaker, you realize that we have 5 level 5 hospitals. Honorable Speaker, Nairobi has a population of 5.7 million. The public hospitals are very few, Honorable Speaker. Then this bill is going to reinforce all its money which it receives from its grants administratively, all its equipments to be updated to the standards that maybe look like the Aga Khan Hospital, Honorable Speaker, which is a very serious hospital where these members go to. So this bill wants to cure such things, Honorable Speaker. Honorable Speaker, I believe the bill was shared in our portal, and the objectives of this bill, Honorable Speaker, if you may allow, and I read, Honorable Speaker, this bill in part 3 provides preliminary provisions for the purpose of this bill promoting access to health facilities, facilitation and realization of the rights and care provided under the Article 43 of the Constitution, realization of the consumer health rights. Also this part, Honorable Speaker, gives the principles of health service delivery, which includes management of health services and adopt the health systems approach as prescribed by the World Health Organization. Honorable Speaker, this part, if you go to Rwanda, and I happened to travel to Rwanda one time, not this assembly, the first assembly, Honorable Speaker, their system works very nicely. You cannot proceed to a level 5 hospital before going to a level 2 hospital, because that's what I believe even the president wants to cure of universal health coverage. Now this bill will tighten and ensure that that one works, Honorable Speaker. Honorable Speaker, also this bill has given the part 2 of it has given the functions of the health services, Honorable Speaker. Honorable Speaker, the sad thing which I know most may complain is decentralization of the procurement services, which will be at the main levels for hospital.
Honorable, if you just settle down, or you excuse yourself.
Thank you, Honorable Speaker. This bill will ensure that those procurement services which are usually done at the city hall, some of them must be done at the hospital level, which, Honorable Speaker, will ensure that our facilities will have enough medicine to that. Honorable Speaker, finally, this bill provides to the Health Committee powers of approving a board. Honorable Speaker, you remember here just people wake up in the morning, they just approve boards without consulting this House. Honorable Speaker, this bill is going to give that platform to ensure that these members of this House are able to approve the board members of these level 5 hospitals and generally the big board which will ensure that the management of this hospital. Finally, Honorable Speaker, which I believe, again, which we are doing, as in my opening remarks, is about decentralization of services. This bill also decentralizes every money received, and now this one will ensure that the CEC for finance will ensure that it safeguards this money and sends these monies to these facilities so that the superintendents in those hospitals, Madam Speaker, know that they are coming here to queue and wait for an approval. They will have to approve at the level 2 hospital, level 3 hospital and level 5 hospital. And for those few remarks, Madam Speaker, I've been really wanting this bill to come in this House. I could wish the Vice Chair for Health to second me.
Honorable Speaker, I'd like to confirm that this bill has come before the committee. We have looked at it, digested it, and asked the questions that are necessary. It has become obvious to us that if we do not look at this bill in the critical way that it deserves, we are going to allow ourselves to relegate back to the dysfunctionality times plague our hospital. Madam Speaker, as has been articulated by the author of the bill, health systems that are being floated or are being put forward are as approved by the World Health Organization, and that have been proven in some other countries, and their working has improved the health services. It is also important to note that it will define and clarify some roles that are now vaguely articulated in the bills that we currently have. It will further ring-fence the FIF. And finally, Madam Speaker, the approval of the board by the oversighting arm will bring the kind of order that we need. Madam Speaker, with those few remarks, and many more that I cannot say now, I would like to second the proposal of this bill. Thank you, Madam Speaker.
Honorable members, I now propose that the Nairobi City County Health Services Bill 2025, Assembly Bill number 3 of 2025, be read a second time. Honorable members, you may debate. Honorable Mark Mugambi Macharia. Honorable Imwatok Peter Jateso.
I was sharing with the Honorable, he was also left, who was crying about my chair for planning. And I was telling him we are also planning for health here today. Madam Speaker, first of all, allow me to congratulate my able majority whip and the entire committee of planning of health for bringing this robust bill. In this House, I've seen bills, and Bishop can concur with me with our knowledge of this House. I have never seen such a big and comprehensive bill as such in this House. Most bills are about 5 pages, at most 10, 11 pages. This one is the most comprehensive bill. I was just speaking to the whip here that during my stay in this county, I was once upon a time disappointed to meet a blogger running a level 5 hospital called Pumwani. He was the chief administrator. At the same time, he was a blogger of a governor. And you all know who he is currently in this county with a lot of vipindi. Content creator managing a level 5 hospital called Pumwani. Madam Speaker, if you look at the objective of this bill is to enable the first schedule of the Constitution that provides the Bill of Rights to Health. Madam Speaker, once again, it's important for this House to enact our own laws. Madam Speaker, the procurement bit of our counties, you hear county government of Nairobi has paid KEMSA more than 300 million, 400 million on medical supplies. And I dare say today, it's high time KEMSA also puts up house in order. There is no way the county government, for those who do not know, as the leader of government business, the county government puts procurement process to KEMSA, but the suppliers are the same officers from the county government. That one, in short, Madam Speaker, if I explain in a minute, you give an order of 500 million to KEMSA. KEMSA calls the same chief officer or CC to provide for them a supplier who imports this medicine from India or China, which takes a long time to import them, and it's an order by the county government. Honorable Speaker, if this bill is going to decentralize the issue of essential procurement from the centralized point of view to the smallest unit, which is the clinics, the sub-county health at level 4, level 3, and level 5. Honorable Madam Speaker, I think this county will move in a proper direction. More important, Honorable Speaker, Madam Speaker, the establishment of the County Health Board. I think we should not joke with the lives of people. The issue of health, they say health is my wealth, not what I own. Today, Madam Speaker, if you're indisposed, you not have the minds as the way you are leading us now. But the only remedy for you to be okay is to be available in a hospital that has every essentials required of you. But also, Madam Speaker, this cannot be practical if the board of directors of these specific hospitals are supporters, are people who are running behind the cars during campaigns. For heaven's sake, we can put you on a stadium board, we can take a social services board, betting board, liquor board, go and do those shenanigans there. But when it comes to the issue of health, we want the assembly to take a center stage. And once again, I congratulate the owner of the bill and the entire committee to accept that all this board must be sanctioned by the assembly. Madam Speaker, I am aware of an hospital, one of the board member is a TikToker. Everything happening in this hospital, including when a bed is being raised from one theater to the other, he takes a picture and TikToks on it. That's the job of a board member. I am aware of a board member who is crying about a CEO just because the CEO refused him to bring a contractor to provide oxygen in a hospital. Madam Speaker, we need people of substance who can sit on a board in the interest of health, not in the interest of procurement on these boards. Once again, this assembly will be called upon to vet properly who is supposed, who is able, who is capable to sit on this board. Madam Speaker, the most important thing to me, that out of 85 wards, at least every ward must have a clinic, at least. You know, when I was born in Makongeni many years ago, we had a Makongeni clinic, which up to date, it has taken 7 years not to be renovated. Madam Speaker, in Eastlands, we were not taking a journey to go to hospital, especially for this vaccination. It gets 11 a.m., your mom says, hey, Peter, come here. You know you're supposed to have given vaccine. And they place gives you the syringe on the rear part, and your mom leaves you at the door of the clinic to go back to the house. So now, this Honorable Speaker, if you want to do anything to treat a child in terms of polio vaccines, all these vaccines, you have to take a journey. Madam Speaker, I believe it's the Committee of Health, upon the passing of this bill, do a proper audit of all the 85 wards. Which ward does not have a clinic, a basic clinic? A basic clinic. That's what we applies to our people. Last thing, Madam Speaker, is to appreciate the entire House for accepting my leader to bring this particular motion before this House bill. And I believe we'll all work together to make sure that this House will be counted when history is written that you brought one of the most robust bill. And my brother Ghetto, congratulations, the entire Health Committee, the entire House. I'm looking forward to see it on the third reading of this bill, subsequently passing it. I beg to support.
Honorable Mark Mugambi, Honorable Matara.
Thank you, Honorable Speaker, for this opportunity. First is to extend gratitude to our able whip for bringing this well thought out bill which is going to go far in terms of achieving several intended purposes, Honorable Speaker. First of all is to take cognizance of the fact that the bill lives to the spirit of devolution, Honorable Speaker, whereby each and every ward, and it's important to note that my ward does not have any health facility. So having a law to ensure that each and every ward benefits by having a health facility will go a long way towards my people be able to access health, which is a constitutional right, Honorable Speaker. It's also important to take note that I've heard of the issue about this assembly being given the power to approve members of the board. You realize, Honorable Speaker, the boards have been used to be as institution to settle political failures or to settle political individuals by the powers that be, Honorable Speaker. So having this House taking part in the processing and approval of those boards will bring sanity in that sector, Honorable Speaker. It will only be my wish, Honorable Speaker, that as a House, because we've lagged behind in terms of business, because our sacred responsibility is passage of bills, Honorable Speaker. So I hope and pray that this bill is not going to lie on the shelves and it's going to see the light of day in terms of passage. And also ensure that once it is passed, the executive is going to put mechanisms in place to develop a policy and develop a framework and regulation to give life to this bill, Honorable Speaker. With those few remarks, I beg to support. Thank you.
Honorable Helen Okello, it looked like you wanted to contribute, or I got the wrong signal. I now call upon the mover to reply.
Madam Speaker, first and foremost, I want to sincerely thank the Vice Chair for Health Services, that's Mheshimiwa Kidenda, the Leader of Majority, Peter Anyule Imwatok. Another one is Jateso, and Honorable Speaker, I could wish also Roro will change his name from, he will ensure that Mark Mugambi, Roro is added there, the way my leader did. His official name is Jateso, and that's a very important thing. Honorable Speaker, I also want to thank Honorable Matara for thinking about it. Honorable Speaker, as I reply, this history which this House must write. This, when you are young people, I remember with then Honorable Anton Kilago in the first assembly, and then March, where Honorable Mark Mugambi took over from. is the pioneer of the bill of the Act of World Development Fund Program Act. And the executive frustrated it for being by the virtue that its tedious implementation, which needs a lot of funding. Honorable Speaker, Madam Speaker, I believe the chair and the vice chair of this committee, my plea is that before we finish our third assembly, at least the implementation of at least every ward to have a clinic, a basic clinic, will be my success in the third assembly. Because I can be in a position to say my success in the first assembly were able to bring a WDP project, a WDP Act. So this one, Madam Speaker, I believe the committee will do that. Honorable Speaker, I believe when it will go for the third reading, I encourage members, as the leader has approached me, of going to do amendments for strict here. He wants to ensure that the leader of majority has said no to bloggers who are supposed to be appointed in these boards. I believe that the amendment, I welcome the amendment, so that we can have strict here people who can manage the facilities. We need professionals, Madam Speaker, to run these facilities. We need our universal health coverage, which the President always is saying that we want it to reach to every common mwananchi. We want them to start learning from Nairobi, because Nairobi becomes the city of hope. And I believe this bill, I believe also the President, the leader of minority, I know, and Honorable Mark Mugambi, now you can tell the President that we have an act which will ensure that the universal health coverage must work. So there will be no excuses that this one is not working, this one is not working, because I know you have proximity to the President. That's why I'm sending you. So, Honorable Speaker, with those few remarks, I want to thank honorable members and thank the House for such a support. Thank you.
Honorable members, I now put the question that the Nairobi City County Health Services Bill 2025, Assembly Bill number 3 of 2025, be read a second time. As many as are of the same opinion say ayes. Aye. As many as are of a contrary opinion say nays. The ayes have it. Honorable members, before we adjourn, let me just apologies for that, clerk.
The Nairobi City County Health Services Bill 2025, a bill for an act of County Assembly of Nairobi City to provide for a legal framework for implementing Section 2 of Part 2 of the 4th Schedule to the Constitution, the regulation and management of the health services, and for connected purposes. Second reading.
Honorable members, I wanted to state that the members, when they request for statement, just be serious with it and follow it up to the conclusion. There is a statement that was requested by Honorable Kiogora. He has been missing for quite a number of sittings when the chair is ready, and I now give a direction that he be given a final notification so that we also don't seem to request for statement for the sake of it. Thank you very much. And in that regard, I direct that the Assembly Business Committee meets after this sitting.